Hi, Dr. Lindsey here. Today I'm going to take you through a repair case on a 50-year-old drummer. Now, some of you guys may know that I'm in a band, and we're always looking for people to add into the band. This guy was a former professional drummer who would be a great addition to our band, but he's probably too talented for our group. And anyhow, we ended up just doing his hair transplant. But he's gone with us to a couple of cover bands, and he's just a very interesting fellow who knows a lot about music. Anyhow, about 3 years ago, he came in to see me, and he's a 50-year-old fellow with lots of hair in the back. It's relatively fine. It's super white hair, and it blends well with his white scalp. And I didn't know it at the time, but he'd already signed up for a hair transplant with a local competitor and was having second thoughts. And so I talked to him, told him I ought to get about 2,500 grafts in the front of his head, and didn't hear back from him. And about 5 months after I originally met with him, I get a phone call from him asking whether we repair a lot of surgeries from blank clinic. And you never know who's calling. We repair people from all over the world. So I didn't really answer. I said, we do lots of repairs. If you want to come back in, we'll take a look at you. I didn't hear anything, and about a year and a half later, he came in looking like this. Man, it's not a bad hair transplant. He had more hair than he had when he first met me, but it's probably not the hairline that he wanted, and it's too few hairs over too many square inches of scalp. And so we agreed to do a repair case on him. And so we did 2,370 grafts by strip technique and really packed him. And here he is at the end of the case. At a week, he had done very good cleaning. At a month, he went with us to see a cover band, and we grabbed this picture on the way over. And at 4.5 months, he looked like this. 5.5 months, really on virgin heads, it starts to grow around 4.5 months, and he's a repair case. So it's kind of starting at around 5.5 months. Here's 6.5 months, and here's a year. And he looks good. He looks unremarkable, which is our goal on people. Not to have a good-looking hair transplant, but just to look unremarkable in everyday conversation. And he did this interview. All right, so you want me to kind of say your real name? Everybody else.
Of course.
All right, so Michael, you're about my age, right? How old are you?
I'm 53.
Oh, you're younger than me.
Yeah.
And you are a guy that I've offered free hair transplant to if you just be a drummer for my cover band.
Right.
And you won't do it. But
well, it's not I've been there, done it, but
that's okay.
Yeah.
So anyhow, I've got your before pictures up to your right, and your story, if I can just summarize, is you came to see me about 3 or 4 years ago, and then you went someplace else. Don't say where you went.
No.
And then you came in and you looked like this, and you didn't look bad because you got that salt and pepper hair.
Yeah.
But it simply wasn't enough, right?
Right.
And so then a year ago tomorrow, we did, how many grafts did we do on you, sir? Do you
2,100.
2,100. And your scar picture is now up to your side.
Yep.
And you wear a really short haircut.
Yep, very short.
And as I say, it's difficult to get a bad scar in an older guy.
Yep.
Older means 50 or older.
Yep.
And fair complected. And you're both of those.
Yep.
And so that's a really good scar, but it's not out of the, it's a pretty normal scar on a dude that's 50 years old.
And you can barely see it if you look really close.
Yeah. And you were pretty nervous when we did you, and then it started growing in, and you came with us to see a couple of cover bands, and any kind of bullshit I pulled on you.
Absolutely not. Absolutely not. Quite the opposite.
And how is this? I mean, has it changed your life?
Yes.
Don't embellish it. Just tell.
I'm going to be honest, if I could. My confidence was definitely pretty low. I was over 50. The midlife crisis deal hits the earring. And no, this really has changed my life. Dr. Lindsey is literally the best in the area, if not, I think he's top 5 in the world.
I'm not sure about that, but
well, whatever. He does a great job. If you want a good price, the price is comparable to any other clinic here in the States. And if you want a good job and people that care, without question, you want to come to Dr. Lindsey.
And we come in and clean on the weekends.
Yeah, no, they're
not just to hang out, but because
no,
better.
Yeah, it's very flexible. He's very flexible. He's very cool. It's a fun environment. The staff's great. We all have a good time, and they make you feel very, very comfortable. So consider it, guys.
So I know we're going to do another case on you, and I just had a guy try out to be my singer. We were doing a second case on him.
Oh, cool.
And I
Nice.
showed his pictures to my band.
Yeah.
And they thought the guy had plenty of hair, just like everybody's going to think you have plenty of hair.
Yeah.
And they want to change the name of our band from White House Plumbers to Hair Greed.
Okay, that'll work.
Because I think you might have a little case of hair greed because you look unremarkable. I saw you at the
really
grocery
appreciate
store
it.
right now.
No,
I would
dude,
say
thank
there's
you.
a dude
Thank
with a
you.
hair transplant.
Thank you. You guys deserve all the credit, obviously. No, but the bottom line is, if you guys want your hair done, don't overthink it, because you're in the right place, Dr. Lindsey. He's an artist. He's not just a doctor, and you have to get the hairline just right. Trust me, because I made a mistake the first time.
Well,
Do it, guys.
Thanks for your business.
Of course.
And so, first of all, the guy's a really cool guy. It's fun to be around, and I think we did a good job on him, and he wants to do an additional case to work on that crown. We see plenty of patients who have seen me along with a variety of other clinics, and although we don't call folks and try to give them hardcore sales tactics, what can I do to put you in a Toyota or a hair transplant today? Some clinics operate that way. And I can remember on a couple occasions, the same place where this fellow went. We actually had a patient on the chair getting his hair put in his head, and the other clinic called to offer a bigger discount. So, when you go to hair transplant consultations, you ought to reasonably get along with the doctor and the staff, because you do tend to have a relationship that's going to last a year or two. You don't have to be best friends, but you should generally like the people that are going to be working on it, and the same with the doctor generally liking the patient. You should see some pictures of before and afters with not just the world's best strip, but with people who have hair like you have. So if you have real thick curly hair, try to find some pictures that doctor did on patients with similar characteristics. And if you have fine Asian hair, well, shoot, look at examples with similar hair qualities, because one person's result with really good hair is not the same result you're going to get with much finer hair with a bigger color contrast. And then go visit the office, preferably during a surgery. And at least at our office, we generally have folks come in and talk to the patient that's getting surgery so that you know that it's not going to hurt. Oftentimes, if you're here in the morning, you get to see somebody who's been done the day before that, getting their head washed. And usually there's a follow-up showing up. So there's no reason why somebody should be pressured into making a quick decision on a hair transplant. And there's every ability now for people to do a lot of research and do the best job picking doctors that suits their needs. If we can help you, please give us a call. Thanks.